to MedPod Today, the podcast series where MedPage Today reporters share deeper insight into the week's biggest healthcare stories. I'm your host, Rachel Robertson. First up, Christina Fiore will share her reporting on the rotavirus vaccine and the childhood immunization schedule. Then I will talk about the controversial, recently released dietary guidelines. And to close out, both of us will share about a new MedPage project mapping the spread of measles. At the beginning of the year, HHS Secretary Robert F. Kennedy Jr. announced that he overhauled the U.S. childhood immunization schedule, moving several vaccines from a blanket recommendation to being targeted to high-risk groups or to using a shared clinical decision-making framework. MedPage Today reporters examined 7 vaccines with big changes, assessing what the consequences of these diminished recommendations might be. Christina Fiore is here to walk us through the series. So, Christina, let's start with the biggest changes to the vaccine schedule. Tell us about those.
Sure. So among the biggest changes were that some vaccines were moved to being recommended for high-risk groups rather than everyone, and this includes RSV, hepatitis A and B, and meningitis vaccines. And the latter two of those, hepatitis and meningitis vaccines, were put on the shared clinical decision-making list for everyone else, along with rotavirus and flu shots. Now, Kennedy had already moved the COVID shot to shared clinical decision-making earlier this year.
MedPage reporters looked at each of these diseases and the implications if fewer people are vaccinated. What stood out most to you in these stories?
Yeah, well, I think all of them are notable, but I was particularly interested in rotavirus. Before the vaccine, about 70,000 kids each year were hospitalized due to dehydration caused by this infection. The vaccine had reduced that to virtually 0 hospitalizations. Paul Offit at CHOP is very well known for being a co-developer of one of the rotavirus vaccines that's commonly used today. And he told me that as a pediatrics resident in the late 1970s, winters at the hospital were really difficult because of all the rotavirus hospitalizations. Children's Hospital of Pittsburgh, that's where he did his residency at that time, it had about 400 hospitalizations each winter from rotavirus. And Offit said, quote, "It just dominated your residency in the winter." But now most pediatrics residents have never taken care of a rotavirus patient.
Who would want to go back to the old days? What about RSV? Weren't we making headway on reducing RSV hospitalizations in infants?
Yeah, we were. We now have 2 monoclonal antibodies for infants against RSV. One rolled out in the 23-24 winter season, and the other was approved last year. And Offit said that we've since halved the number of hospitalizations in children under 7 months old. But now experts are concerned that all of those gains will be lost. And I just want to say that as a parent, I've known several friends whose kids have been hospitalized due to RSV, and it's terrifying. I mean, imagine not knowing if your kid is going to leave the hospital. So I think it only makes sense to do everything you can to avoid hospitalizations in children.
For sure. What about the other diseases that we looked at?
Yeah, so for hepatitis A and B, the CDC estimates show that routine vaccination prevented 10 million cases, 1 million hospitalizations, and 91,000 deaths over a 30-year period. Bacterial meningitis is a rare disease, but when it hits, it's deadly. One study estimated that vaccination prevented about 500 cases of invasive disease over a 15-year period, and the majority of those cases would have been in teens and adolescents. Those are young people with their whole lives ahead of them. And we all know that flu vaccine uptake among kids isn't great, but nonetheless, vaccination was estimated to have averted almost 12,000 hospitalizations and 170 deaths among kids ages 6 months to 4 years in the 23-24 flu season, and another 8,000 hospitalizations and 90 deaths in kids ages 5 to 17. So again, that's hundreds of young lives saved.
It was great to work on this series, and thank you for giving us the big picture on how this all shakes out.
Yeah, thanks, Rachel. And now I'll take the host seat for this next segment. After months of anticipation, the Trump administration finally released new dietary guidelines. These guidelines have changes like replacing My Plate with an inverted food pyramid with meat and dairy at the top, among other changes. Rachel will fill us in on why those guidelines are making a splash. Rachel, can you start by giving us a little context on what these dietary guidelines are and how they came to be?
Sure. So every 5 years, a group of experts convenes to systematically go through evidence and make recommendations on how HHS and USDA should update federal dietary guidelines. This group is called the Dietary Guidelines Advisory Committee, or DGAC. It's a 20-person committee of experts who volunteer 2 years of their time to do this. The government doesn't have to take any of these recommendations, but most of them tend to go through into the actual guidance. The most recent DGAC submitted their 400-page report right before the second Trump administration. Health Secretary Robert F. Kennedy Jr. and others have spent several months criticizing and in some cases even suppressing the findings of this report. And the new federal dietary guidelines for 2025 to 2030 veer pretty far from DGAC's report. I'm sure many of our listeners have seen the inverted food pyramid by now.
Yes, and you spoke with some of those DGAC members. So what did they tell you?
Yeah, I did. I spoke with two of the most recent DGAC members, and both were pretty upset by how things have gone down. Christopher Gardner, who is an expert in diabetes and nutrition at Stanford University, he told me that it felt like a slap in the face to the hundreds of hours of work he and other DGAC committee members put in on this work. Plus, there are errors sprinkled throughout the new guidelines, which he said indicates that the wrong people without adequate expertise were in charge of making this major document. Another former DGAC member, Fatima Cody Stanford, who is an obesity medicine physician at Harvard, she told me that she thought about doing like an annotated version of the guideline highlighting its errors, but there were simply too many. Like, it wasn't reasonable. Much of Kennedy's criticism of DGAC's work has focused on what he perceives to be conflicts of interest and on the committee's focus on DEI. Both Gardner and Stanford noted that any group of high-level experts is going to have conflicts of interest, even if it's just an honorarium or a flight being covered to speak at a conference, and that the people who ended up working on the dietary guidelines that were released had major ties to meat and dairy industry. And as for diversity, it was one of the many considerations that they looked at when assessing evidence. Obesity was also considered for the first time in the most recent DGAC. DGAC as a whole was subject to transparency measures out the wazoo, and these guidelines were crafted in the shadows.
That doesn't surprise me. So what are the professional groups saying about all this?
Yeah, reactions have been pretty mixed. Not everything included in the guidelines is bad. It emphasizes eating whole foods, which is pretty universally agreed on to be good dietary advice. And there's still lots of crossover from previous years, so not everything in it is crazy. But again, the DGAC members I spoke to think that professional groups could have taken a stronger stance in standing up for scientific rigor. A lot of important analysis and insight was lost in the butchering of this process.
All right, well, thanks for that report, Rachel. I am going to turn the host seat back over to you.
Sounds good. Thanks, Christina. And now for one last segment together. This time we are talking about measles and how the US is experiencing its worst resurgence of the disease in more than 3 decades. We're also at risk of losing our measles elimination status, which we earned in 2000. Late in 2025, Christina and I launched a map tracking measles cases and hotspots. Christina is going to give some insights on the underlying data, and then I'll detail our latest update from earlier this week. Christina, go ahead and give us the background on how the measles map came to be.
Sure. So I had interviewed Dr. Megan Ranney, the dean of the Yale School of Public Health, for a story on a data dashboard that they had created called PopHive. And during the interview, she mentioned that someone else in her team was tracking the ongoing measles outbreaks and sending situation reports to public health officials across the country. She was going state by state, gathering data and keeping a large email group posted on where the biggest outbreaks were. And I spoke with her, and her name is Joanne McGovern. She's a retired lieutenant colonel in the Army who has extensive experience with disaster response. And she and many public health students of hers have been putting their report together, and they call it the Virtual Medical Operations Center, or the VMOC Special Report. They've been doing that since early last year. They started with the West Texas measles outbreak, of course, and they track cases not only in the U.S., but also in Mexico and Canada. And as you know, Canada lost its measles elimination status in November. And I was going to do a story on this, but then I realized that you had data wrapper skills and that we could do this visually. So we could make it very easy for readers to see where new cases were cropping up and which states had the worst outbreaks. Rachel, do you want to start us off by catching us up on how things went in 2025?
Yeah, sure. So you mentioned the West Texas outbreak, which was declared officially over in August. It reached 803 cases. It spread into New Mexico, which hit 100 cases before being stomped out. Cases also appeared in Arizona and then pushed into neighboring Utah, and most public health experts believe that outbreak is also tied to West Texas. There's also been a big outbreak in South Carolina. There's a little less certainty around whether that outbreak is linked to West Texas, but there's been some reporting that the same measles strain is seeding outbreaks across the country, so it's likely that it's connected. Overall, we ended the year at 2,143 measles cases, though that may change as some states are still reporting their final data for the end of 2025.
Okay, so you want to give the viewers a little bit about what our latest update shows.
Yeah. The Yale Group's report from this Monday tracks cases through early January. 10 states had new cases in the week prior, and you can see those are the states on our map that have the shaded bars over them. The Arizona and Utah outbreak is ongoing with 8 new cases in Arizona and 20 in Utah, and South Carolina's case count exploded over the holidays with 125 new cases reported in just 1 week. There was another update since the Yale Group's data came out showing an additional 124 cases, bringing the total for the outbreak to 434. It was also confirmed that the 3 new cases in Ohio were tied to the South Carolina outbreak. Experts are clearly concerned that it's going to take a while to get things under control there.
For sure. Yeah, we'll keep updating the map every Monday so everyone can follow along to see whether we're getting those outbreaks under control.
That's right. And everybody should bookmark the link to our map. We have the link posted in our show notes. And that is it for today. If you like what you heard, please leave us a review wherever you listen to podcasts and hit subscribe if you haven't already. We will see you again soon. This episode was hosted and produced by me, Rachel Robertson. Sound engineering by Greg Loud. Theme music by Palomar. Our guests were MedPage Today reporters Christina Fiore and Rachel Robertson. Links to their stories are in the show notes. MedPod Today is a production of MedPage Today. For more information about the show, check out medpagetoday.com/podcasts.